Hello and welcome. My name is Sharik Peck. I'm a physical therapist by profession, and I have been a proud member of IAFNR for over 5 years. I'm very excited to share some things that we have been working on and trying to understand that are helping a lot of clients, and I think can help you. My hopes are that you'll be able to take some of the things that I share with you today and immediately put them in place in the next couple of days as you work on clients and your own family members. Today, we're going to talk about the role of critical organ activation in neuroplasticity. This becomes really important. Many of you know my own story, but I want to share just a few details again. Back when I was 17 years of age, I was in a wrestling match and got caught in a bad headlock. I had broken my neck a number of years ago, but we didn't realize the instability that I had at C1 and C2 from not having an odontoid process in there anymore. I got caught in a bad headlock and it ruptured a vertebral artery. And I got to learn how to walk again and learn how to function again. But one of the things that I did not understand fully until just the last few years was why ever since then I have had a difficult time with my intestinal system and my organs and getting things to work right. No matter how hard I trained or what kind of nutrition I threw in there, I still had a difficult time that I believe goes back to this initial injury, vertebral artery dissection. I want to send out a huge thank you to our IAFNR team. Years ago, when I first started showing my device, I think it was an IAFNR conference in Las Vegas, back when we were in person, a lot of people that came up to me asked me, okay, what's the research behind your device? And at that point I said, well, my device is just a couple years old. It doesn't have a lot of research behind it, but you guys encouraged us to be involved in research and prove the efficacy of our treatments and protocols that we recommended to doctors all over the world. Well, that led us down a long rabbit hole, and eventually we've now completed our second research trial, and we have our third one underway. But this first one was finally published in the journal Oral and Facial Pain and Headache earlier this year on resonance massage tool effects in non-migraine headache management. I hope you'll find it, take a look at it, and enjoy the full results. Well, here are some of those results. The experimental group experienced substantial pain reduction compared to the control group. Now, I know you're probably wondering, okay, how did they do this? How did they look at both an experimental group and a control group and use the same device? We actually sent to the testing group a bunch of our units that no longer had the counterweight on the motors. Instead of producing vibration, it just produced a little bit of a high-pitched noise from the motor spinning, but not creating the vibration. What's cool is we saw lasting benefits. Benefits persisted 6 weeks after treatment, indicating long-term efficacy. I mean, we'd like to see what it is years after treatment, but that would have taken a long time to get that research published. Maybe a long-term study would be great next. The targeted relief, we saw that it alleviated muscle tension and nerve hypersensitivity, addressing root causes rather than just the symptoms. We're super excited to see that in black and white. Now, how does that pertain to gut health following a TBI or concussion? We were focused on our headache protocol as much of the things around the cranial nerves and affecting things up here. But we find that when a person has a TBI or concussion or a serious injury, whiplash, oftentimes their intestinal system goes south in a hurry, has a hard time functioning. And we see in particular that there's this bacterial translocation, meaning that things start moving to places where they shouldn't be moving to. We see sepsis oftentimes, eventual multi-system organ failure. But here's the big thing. Nobody knows exactly why this increased intestinal permeability follows TBI. We're just not sure, but it is seen in almost every case. And it certainly was with me after my stroke years ago. There's a blunting of intestinal villi, increased intestinal permeability, GI dysfunction. All of these are well researched and found, again, just not exactly knowing why. But we do see these mucosal alterations, ulceration, inflammation, increased gut permeability, autonomic dysfunction, systemic inflammation, and organ dysfunction. I want you to pay attention to that last one, that organ dysfunction. Part of my hopes in this presentation are to share with you some of the things that several practitioners recently have been working on and helping us to try and understand the whole organ issue, how to work on turning those systems back on when they've had the switch flipped into the off position or partially off position, especially following a brain injury or traumatic event in a person's life. What role do chronic pain, dysmenorrhea, and neurologic trauma play in gut function? Our second big study is on dysmenorrhea. And we chose that to look at organ function, especially in females that have this monthly menstruation pattern that seemed to make it a really good way to study that. We have this inhibition of progress after the onset of TBI, concussion, stroke, and neurologic conditions. We have a hard time getting all these systems back and communicating. And then we take in one other issue. We just are not getting enough dietary fiber, and global constipation cases are rising rapidly. That goes offline even faster following a brain injury. And it's important for those of us who have been through that to figure out this component, because you got to get stuff moving through there for us to be healthy and get the brain functioning correctly. What is the role of the vagus nerve in relationship to our gut health? We know that approximately 81 or 83% of the messages relayed by the vagus nerve system are coming from the gut and the GI system and the organs and sending those messages to the brain. Now, the digestive system, it's one of the largest surface areas of our body exposed to the outer world, 344 square feet roughly. That's just a good rough amount of surface area, isn't it? We thought we would bring in a vagus nerve exercise breathing expert. Why don't we do this for a few seconds, because I want to improve your attention span for the rest of this presentation. Will definitely reduce your negative emotional effect and lower cortisol levels. So here we go.
Here's how you do diaphragmatic breathing exercises. Now, these physiotherapy exercises are done either lying down, sitting upright, or standing tall. You'll start your breathing exercises by placing one hand on the upper belly and the other hand on your chest. Now, this is to feel the movement underneath your hands as you breathe. As you breathe in slowly and deeply via the nose if you can, so that your hand on your belly expands and moves forward as you breathe in. The hand on your chest should remain motionless throughout. Start now, breathing in slowly and deeply through the nose. Feel the hand move forward and the waist widen. And now let the air gently fall away through the mouth and relax. And that is how you do diaphragmatic breathing exercises. You can do 3 to 4 of these breathing exercises anytime during the day.
So there we have it. Let's keep breathing during this presentation, throughout your day, throughout the weekend, and as you work with your patients. Actually, breathing is such an important component. Remember that there is a ventral vagal connection with breathing that's really important. Sure, breathing happens on autopilot, but it's also something that you can effectively make changes with. Your breathing patterns, you can affect change, and that is a ventral vagal function that you can control the breathing. There are some vagus nerve exercises for digestion besides breathing that are really helpful. One of those is cold water exposure. One of the things we've seen in research is that for elite athletes, just 15 minutes of cold water immersion reduce stress, anxiety, depression, muscle aches, and cortisol levels. I believe that cortisol levels are part of the reason that the organs have such a hard time getting back online after a traumatic brain injury or concussion. Those cortisol levels keep the stomach upset. It's part of the body's natural response to stress, but when you have the brain in a state of stress, it keeps the whole body in a state of long-term stress. A couple of tricks for those of us that have a real hard time jumping into the cold water with ice cubes. You can place a cold pack on your chest, or end your shower with a blast of cold. Drinking a large glass of ice water also will do the same effect and improve your vagus nerve functioning as well. What we see is repeated whole body cold water exposure, and likely with these other tricks as well, you'll see a decrease in the sympathetic tone and an increase in the parasympathetic tone, which is what we need to put the body back into a great healing state. A couple of other really great things to help us out. There's the great tool of gargling, humming, singing. Most of these engage directly the vagus nerve through the recurrent laryngeal branch, which, as you know, has a real strong connection to vibration. In fact, it controls your vocal cords. So laughing out loud, chanting, all of these things are extremely helpful to improve the tone of the vagus system, which helps get that GI system back on track. Another couple of things that the research has shown is that Tai Chi in particular and moderate intensity interval training help improve the symptoms of low vagal tone, particularly in irritable bowel syndrome and other conditions. Vagus nerve activity increased significantly after the cessation of moderate intensity interval training. I hope that that's something that we can do with all of our patients. Get them breathing heavy, get them using their muscles heavy, and then let them recover, improving the tone of that vagus nerve system. Mindful eating has also been shown in the research to reduce stress and activate the parasympathetic nervous system. What that means is that you taste your food and don't just inhale it, that you take the time to smell it, feel the texture, talk with others while you eat, and chew your food more thoroughly, and avoid overeating. All of these things have been shown to improve the overall function of the vagus nerve system. So eating habits can be really helpful. And here's a little bit about our active study of the dysmenorrhea issue. Now, part of the reason that we chose dysmenorrhea, again, is that all of these organs involved in the painful period and cramping and all of those areas down in the lower abdominal region, all of those are connected to the vagus nerve. All of those have a role to play in vagus nerve tone and efficiency. Both of those are really important. In this particular study, we have completed the study. It's now under review. Here's a little bit about what that looks like. Significant public health issues have been identified. Both physical and psychological issues have been identified as being part of the dysmenorrhea equation. There are detrimental analgesic effects, especially with the medications. There's a tolerance issue, a dependence issue, GI discomfort, hepatic and renal impairment. All of those have come from problems with medications trying to help people with the dysmenorrhea. A little bit about the procedure that we undertook for studying this. Just the same as we did with our headache study, we took a device that no longer produced vibration, but it lit up. And we used this in exactly the same placement on our control group. And in our research group, it was really fun to see the results. 18 to 15 years of age, 12 weeks of therapy, and 3-month follow-up period. We wanted to see how long the effects could last. We looked at it 5 times per week, same treatment during the menstrual cycle. So essentially we did it a week before the cycle and a week during the cycle. And then we gave them a couple of weeks off, and then we repeated the process. This happened for 3 months. Here's what that process looked like.
The Rezimax Tuner Pro 2 is currently the subject of a study evaluating the efficacy of treating symptoms of dysmenorrhea. In this recipe, we'll show you how to get relief from the pain of dysmenorrhea. Each participant in the study received the following instructions. Place your tongue between your teeth. This helps to unclench your jaw. Hum gently along with the resonance of the Tuner Pro 2. This helps your vagus nerve to magnify the positive effects. For each of the steps, choose an intensity level that feels comfortable. For these exercises, you'll need your Rezimax tuner and accessory tongs. And the runner's belt pack, if you have it. Go ahead and grab your Rezimax neck pillow if you have one. Step 1. Attach your accessory tongs to the tuner. Place the tongs on both sides of the neck, with the tuner resting against the spine. Hold the tuner in place with your head. With a light amount of pressure, slowly rotate your head from side to side, keeping pressure against the tuner. Keep the tuner in place for 2 minutes. For extra support, you can place the Rezzi neck pillow behind your tuner. Step 2. Apply a light amount of pressure with the tongs under the jaw, holding the tuner with both hands. Keep the tuner in place for 2 minutes. Step 3. Let's get down and set the tuner on the floor in front of your seat. Using a moderate amount of pressure, squeeze the tongs with the instep of your feet and rest your big toes on the wings. Keep your feet in this position for about 2 minutes. Step 4. Before we begin, let's remove the accessory tongs from the tuner. Grab your runner's pack and place your tuner inside, zipping it closed. Strap the pack so that the mesh side is against your lower back. Make sure to tighten it enough to give you a moderate amount of pressure. Keep the tuner in place for 2 minutes. If you don't have a runner's pack, you can hold the tuner behind your back or sit against it to keep it in place. Step 5. Find a comfortable place to lay back and use a light amount of pressure to place the tuner on your stomach. The tongs will come to rest at the base of the stomach. Keep the tuner in place for 2 minutes. Thanks for joining us today. Don't forget to subscribe to the Rezzi YouTube channel where you can tune in to more recipes and other exciting videos. Together, we can tune out pain and tune into life.
As a quick recap, the back of the neck for 2 minutes and turning the head side to side. This just helps with the C1, C2 tension that people build up in there. Get those rectus, capitis, posterior, minor, and major, and all of those teeny little muscles that are involved in head positioning, get the tension off of those. Then we do it in the front of the neck, where we work on the sternocleidomastoid and some of those big neck clenchers that are part of the tension equation. Then we did it at the feet. And if you look at the positioning on there at the feet, we have the tongs of the device right against the inner arch, which is, if you look at Chinese medicine foot chart, we're right in against the adrenal points. We put the big toe up against the top of the scraping mechanism on the tuner. That just helps get the upper cervical area relaxed further, which helps take tension off the whole system. Step 4 was just placing it so that we put the tong parts over each ovary area. Also the diaphragm, we wanted to connect those areas so that we're helping improve vagus nerve function in all of that. And then we put it at the low back because of all of the ascending and descending spinal tracts. Just 10-minute protocol. The results were quite phenomenal. Demonstrated a reduction in dysmenorrhea symptoms, which validated the efficacy of using this as a tool, and assessed long-term benefits of resonance-based therapies on primary dysmenorrhea, which is pretty amazing. It was fun to see that. Further research, of course, is always warranted, but it'll be neat to see what happens in time. Another thing about the study is it's currently under review. We'll hope to see that published later this year. Definitely improved things during treatment, improving with each treatment cycle, and it did decline about 12 weeks after the study, which just means that it's likely that if you're going to use something like the Rezzi tuner as a device to help with all of the abdominal and dysmenorrhea issues, you likely need to continue it on longer than 3 months. As you're talking with your clients, help them understand this is not a quick fix, but one definitely researched and showing the improvements over time. There is a third study that we're currently underway with using these resonance-based therapies. It's an independent TMJ-TMD study. It's happening at a major USA university dental school, and it started in 2024, and it's still currently going. We'll hear about it one day. Now, I want to switch gears just a little bit for the rest of this presentation and talk about something that has been mind-blowing for me. And it all started with Dr. Ed Chauvin. Ed is from Abbeville, Louisiana. You'll hear that in his accent. Just a fascinating chiropractor, more than 40 years strong in the profession. He's had several major life-changing issues. In fact, he's got a steel plate up in his head. He had a massive aneurysm. There's no way he should have ever survived that. Had some really unique experiences through all of this, but he just happened to have a neurosurgeon roommate from college that happened to be nearby when this whole thing happened, when he had his aneurysm and he's in the ICU and trying to prepare him for burial. Somehow the family was able to get a hold of his friend. He performed immediate surgery, got the pressures off of that area. An astounding series of events that could have only happened in small town Louisiana. Dr. Chauvin has brought some enlightenment to our understanding of how to use the resonance tools, especially of our vibration device that we created, to turn on organ function and to identify when the organs and parts of the body are not functioning very well. In the next few minutes, you're going to see and hear some of his discussion on how he came to start understanding this. It's a thing that we found that using our device, we have these 4 algorithms in it. And there's a blue one, a green one, a red one, and a white one. Well, in particular, we found that blue, green, and white are really good at strengthening neurologic systems. You've probably seen this in practice a lot. I've definitely seen this in a lot of people. Blue, green, and white are really good at calming the system down. Red, on the other hand, is really good at activating. And now we understand that it's good at also demonstrating where weaknesses are. So you're going to see a few things in the next couple videos that I hope will be real helpful. We invited Dr. Chauvin to come out to Salt Lake City to our conference a couple months ago, and he demonstrated some really neat things that we're going to share with you now.
Hi, I'm Dr. Edward Chauvin. I'm from Abbeville, Louisiana. I've been a chiropractor for 41 years, and we're doing amazing stuff with the brain and nervous system now, using a revolutionary technique called quantum neurology.
At the Rezzi Max Professionals Conference, Dr. Chauvin is sharing breakthrough techniques you can start using right away. Simple ways to identify malfunction in the body. How to reset neurologic communication. Combining the Rezzi Max tuner with organ-specific protocols for faster healing.
I used to do all this with tuning forks, but I had a bag of tuning forks. It took like 3 hours to work on a patient. Well, you don't have 3 hours to work on patients. Sharik gave me a great tool. It's called a Rezzi Max Pro, and I gotta tell you, I don't want to practice without it, and eventually every one of my patients is gonna have one. I see people with Parkinson's disease, tinnitus and vertigo, irritable bowel syndrome gone. People have had knee replacements and still can't walk, and we get them completely healed and walking. What we use the tuner for is there's a brain signal. It's not going to the organ. By taking the Rezzi Max tuner and finding the brain map of where those nerves come from in the brain, you can actually turn that off and they go from like this to completely still with their arm. It amazes neuroscientists, neurologists, and neurosurgeons, and chiropractors, and quantum neurologists, as a matter of fact.
Join us May 10th in Salt Lake City, Utah.
From that event, that brought together some really fun doctors. Pictured in here, you can see Dr. Kelly Farmer from Salt Lake City. He works with the University of Utah football team.
Get ready, Salt Lake City. The Rezzi Max Professionals Conference is coming May 10th, and Dr. Kelly Farmer is bringing the heat.
I'm Dr. Kelly Farmer, founder and chiropractic physician. My specialty is more orthopedic-based chiropractic medicine. I'm also an athletic trainer and rehab specialist. Originally started off as an athletic trainer for the University of Utah and loved working with athletes. Chiropractic was a natural fit to help change the neurology of how the spine and body and the brain controls everything. And the techniques that I practice and have found are what really optimizes a patient's nervous system and their muscle-body connection.
At the conference, you'll learn how Dr. Farmer integrates the Rezzi Max tuner into his neuromuscular activation protocols to enhance outcomes.
I've been really interested in this tool because a lot of my friends and biohacking colleagues use this tool for neurostimulation and really changing how the brain assimilates and uses the body.
Whether you're working with athletes or everyday patients, Discover how combining cutting-edge resonance therapy with chiropractic care can elevate your treatment results. The Rezzi Professionals Conference, where innovations meets results.
Dr. Noah Moose from Texas, he has helped an awful lot of great athletes, professional athletes and Olympic athletes in particular, running athletes. He's helped so many people and average individuals with brain injuries as well.
Meet Dr. Noah Moose, a leading force in neurological performance and rehabilitation. Based in Austin, Texas, Dr. Moose is a quantum neurology master practitioner and has worked with Olympic athletes, elite performers, and individuals overcoming complex neurological challenges. His innovative approach combines primitive reflex integration, functional neurology, and advanced movement protocols, restoring power, balance, and resilience in even the most challenging cases. And now, Dr. Moose has added the Rezzi tuner to his protocol, bringing faster nervous system resets, deeper reflex integration, and improved outcomes for patients of all ages. At the Rezzi Professionals Conference, Dr. Moose will share how he integrates resonance therapy into his treatments and how you can use it to elevate your own clinical outcomes. Join his interactive breakout sessions to experience firsthand the same tools he uses with Olympic athletes to unlock optimal performance and long-lasting healing. Come experience the breakthrough. Heal better, perform stronger with Dr. Noah Moose and the Rezzi tuner.
Dr. George Gonzalez from California, he is the father of quantum neurology.
This May at the Rezzi Professionals Conference, get ready to unlock a whole new level of healing potential. Meet Dr. George Gonzalez, founder of Quantum Neurology, an innovator in neurological rehabilitation. Dr. Gonzalez has trained thousands of doctors worldwide in his breakthrough system to restore neurological function through precision, intention, and hands-on technique.
Quantum neurology is nervous system rehabilitation. We teach doctors how to apply quantum physics principles to the nervous system to maximize healing and human performance.
When we combine this with the Rezzi tuner, the results can be profound. By pairing the neurological protocols of quantum neurology with the vibrational precision of the Rezzi tuner, practitioners can achieve faster, deeper, and more lasting outcomes. Join Dr. Gonzalez for hands-on workshops at the conference, where you'll learn how to assess, activate, and amplify the body's healing response. Get real-time guidance, ask your toughest questions, and leave with techniques you can use immediately in your practice. Whether you're new to neurological work or looking to expand your toolkit, this is your chance to learn from one of the greats, the Rezzi Professionals Conference, where innovation meets activation.
He and Dr. Chauvin have spent a lot of time together, and he's helped understand this concept of the holographic nervous system and this communication from top to bottom that's been incredible.
So there's a movement principle I wanted to share with you. I talk about holographic communication. That means the whole body communicates as a unit. Okay? So there's a difference between, I don't want to push on you, but I just want you to feel what I'm talking about. So if I push you with my arm, I'm using the muscles from my arm. Okay? But if I'm using my whole body, I'm training my whole body to do one thing as opposed to try and do one thing with my arm or my leg, or right?
Like you're trying to do the whole body. Okay.
Putting your hands together.
Can you do that for me?
Yeah.
Can you just do it
And you want to move anywhere, up, down, and touching your body. You want to be touching your body as you're doing this.
So you want to keep the hands
Yeah.
on the body.
And what that's doing is the right side is training the left side, and the left side's training the right side. And because she's contacting the body,
Like this?
her body can feel it. Does that make sense?
Yeah, that does.
Because it's that middle space that has no connection that's very hard for them to see it neurologically speaking. So if she's touching, she can feel that. What was the guy, Atlas? The opposing muscles? That stuff's real. It's real. And if she starts getting into the hang of grinding through movement like that, like this, she's going to start feeling that opposing motion within herself. And that's what's necessary. Right.
So we're also doing like pushing like this.
Yeah, so just everything. And this is for the whole body. So I'm going to balance here for a second. So, but if she's picking up her leg like this, she can't feel it. But if she's picking it up, touching her body, she could feel it. Okay? And through that, she's going to be able to gain strength and coordination. and awareness. So it's important for her to learn how to contact every part of her body, whether it's her hands or arms or legs.
Can you do flamingo and drag your foot up your leg
Yeah.
while you do flamingo? Could you do that for me?
There you go.
Oh, yes, look at that pretty bird.
Good.
Yeah.
Excellent.
I love that.
So as much as you could do that, the better, okay? To keep that connection. Does that make sense, honey?
Yeah.
Yeah, it does, huh? Yeah.
Remind your body.
Yeah, remind your body where it is in space.
Can you do flat hands?
Yeah, and then you can move against your body. Yeah,
Is
there
there
you go.
like any kind of timeline
no.
or amount, just whatever
This
is
is
helpful?
going to be helpful for her to gain her movement back, okay? Because like I said, the brain doesn't see this. It sees end ranges. So when somebody with certain types of movement disorders, you'll see them doing this, right? It's because they can only feel the end range. They can't feel the middle. So they're stuck moving like this, okay? And so what we want to do is by doing this, we want to train her where that middle range is.
And then she use kind of what we were doing before,
Yeah.
using that Rezzi Max.
Absolutely.
And just having her move it. It'll help her wake that up to her nervous system to be able to find it again. And then as she does that, so she can do that to like wake it up and then take it away and then just have her moving it like through in there. So it's like kind of do some with it and then some without it, some with it, some without it. And through all those ranges of motion.
A real gentle balance. So maybe like a foam pad, like a gymnastic rolling pad. You know, if she does her flamingo there, it's going to cause a little more of a check system for her.
Yeah,
which is
You
good.
get like those AirX pads on Amazon
Yeah.
for like $10.
Something real simple, doesn't have to be thick. Yeah, and the same thing for sitting also. When she's sitting on something, they have those discs, a little inflatable, and that way it's going to force her to find her proprioception, it's called. Okay? So really work with that holographic concept. That's going to help a lot, okay, honey?
We can do that.
Yeah. Whenever I'm in pain, I do that. So if I hurt my back, I have a wooden dummy I practice with, and I move. I'm grinding movement the whole time, and that'll turn everything back on. Exactly.
And then you see my good friend, Dr. Patrick Jones, the homegrown herbalist and YouTuber on how to take care of your family. He's a veterinarian and also works with humans as a naturopath.
I'm Dr. Patrick Jones from the Homegrown Herbalist School of Botanical Medicine. Sharik is a dear friend of mine. Sometimes approaching something from more than one angle is extraordinarily powerful for healing and for helping the body. In addition to that vibration, you can put other things on there to enhance and work with it. You know, there's herbs too that can help nervous pathways remember their job and the brain to remember its job and the brain to heal from injury. And when you put those in the mouth, the absorption through the mucous membranes of those phytochemicals in conjunction with that vibrational therapy, that's a 1-2 punch to get your cranial nerves woken up and remembering what the heck their job is and quit being silly and start smelling the flowers again. Frequency is an extraordinarily accessible thing to the body. For some reason, frequency has a lot of healing, reestablishing neural connection. It just does all kinds of amazing things. I've been doing acupuncture with tuning forks. We do auricular therapy with tuning forks. It's the same principle. When you have different modalities that are working on fundamental things that the body understands and likes to use, and you combine them, the herbs, the vibration, all those things together can be really astoundingly powerful. As an herbalist, sometimes I can't use herbs on somebody. I can always do the tuner. It doesn't matter if you're pregnant. It doesn't matter if you're nursing. It doesn't matter if you're an infant. It doesn't matter if you're a puppy dog. The vibration is perfectly safe and has an extraordinary power to reboot and recalibrate and open up neural pathways, stimulate cranial nerves, stimulate the vagus. I'm a big fan.
These are a few of our people that came out to Salt Lake and spoke recently. Here's a couple of other things that we have found really helpful in the process. Lasers and that communication that they provide for the mitochondria, or just energizing those systems, really, really helpful. Essential oils, and more, I'm using less essential oils and more natural products that we can find, like the lemon more than I like the lemon oil, for example. Anything that we can find that's a natural substance that God created on this great earth. These are things that help wake up the olfactory system. All of these things are geared towards helping improve the efficiency of all of the cranial nerves. And in particular, the stim pod has proven to be an excellent tool for waking up nerve pathways that help with areas of the body that have gone dormant or the communication's been messed up. I like the lasers for helping energize. I like the stim pod for helping improve the communication. I love using vibration and particular scraping of everything from the toes all the way up to help improve the body map. The GRT light, that's something created by Dr. George Gonzalez, a phenomenal way of telling the brain and the body where the parts and pieces are and helping them remember how to function again. Here's a few components that are really helpful. In particular, we want to test for weakness in the organ communication. Remember, those are the vagus afferents. In just a minute here, you're going to watch Dr. Chauvin do a little bit of that with the vagus afferents and also particular spots on the body that cause this communication system to go offline and how to bring those back online. So I hope you pay close attention to that. And then I'll show another little section where we do that on each individual organ, how we can use these tools to wake back up the brain's communication with the organs. We're going to check for and strengthen primitive reflex patterns associated with limited function of the organ networks. We're going to teach you how to flip the switch or bring the organ back online and strengthen the feedback loop, and then how to retest that. I hope that once you understand this concept, you can teach your clients to repeat this process daily until those patterns remain strong. I think this should be delightful. Here first is Dr. Chauvin. He's working on Dr. Sean Drake out of Arizona. He works with a lot of professional athletes, golfers, and baseball players as well. And he's an ultra triathlete. This guy's in really good shape, but I think it'll be fun for you to see how Dr. Chauvin uses the device to help identify weakness patterns in Sean's system.
I learned everything with tuning forks for hearing, with tinnitus and all that. And I'm glad that I learned it that way, because if you actually find a frequency or several frequencies that people are weak to, it's weak on every part of your body, not just your hearing. Every nerve in your body can hear, but you have specialized organs called ears that help you to hear. But every fiber in your body can hear. Every fiber in your body can see. And I'm showing you some of the stuff you can't see. He is a right sympathetic dominant patient. Whenever you have more tonus on that side, that's the side of sympathetic dominance. You go here and you check this. Yeah, he can turn in a lot more on his left side than he can on his right side. Or if I go this way, because they think, oh, you're doing it the wrong way. Watch how strong. Strong like bull. Weak like kitten. You don't know that that's happening, Sean. So we got to fix that, right? Now, I can do my 20-second test on you just to show you that it's coming from your autonomic brain. I just want to show you. Goes right away. Primitive reflexes, no. Yeah. With 20 seconds from now, he's going to go right back into the same pattern. This is a big deal because your body cannot heal unless it's in a balance between sympathetic and parasympathetic. So you may feel good and you go, well, I'm exercising and I feel good. And, there's nothing wrong with me. But these are invisible things you can't see. He's back. Right back in the same pattern. Now, get up and do my hummingbird exercise. Squat forward. Look up at the ceiling. Kegel, say nyuk, 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 nyuk. So, yeah, but. Okay, he's in balance. And I'm just going to go up and see if there's one spot I can find that nobody's finding. Right there. He got a spot right on his knee. I don't know why. There it is. Keep that on there. Now, push your leg up. See, you got nothing. What you're doing is you're using the Rezimax to send a sympathetic signal to a hurt area into his brain. So that really shuts it off. Now, if I check it without that on there, he's probably strong.
Oh, yeah, I'm sure he is. Check that.
What? Push up. Oh, isn't that cool? You like that, huh? Put it right there. Now, try it again. Push up. Push. Push. You can't do it. Bring this leg up.
It's the correction that help it hold.
Okay. Push your leg down against me. Push all the way down. Kegel, 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 kegel. Say nyunk, nyunk. Bring it back up. Push it down. Push. Push, push, push. And don't worry, I'm not a surgeon. I'm not working on the wrong leg. Push, push, push. Oh, there you go. If you fix the myotome to a sympathetic, parasympathetic state, then it can heal. We need Denise over there on the top of the knee. And push up. Oh, he got strength now. And he's got balance too.
We've still got it on the red algorithm there, the diagnostic algorithm, if you will. Here's another thing that we found extremely helpful. If you want to get all of the communication with all of these organs, there's another area that you ought to spend some time thinking about and worrying about, and that's the lymphatic system. We developed a quick little protocol, and you can do this with any device that vibrates, but we found this really helpful with our device. And let me just show you that process. Lymphatic system has 5 key areas. Here we go.
We're going to use the Rezzi Max tuner to clear out your lymphatic system. Remember to place your tongue between your teeth and hum gently along with the resonance of the tuner, while breathing out for 4 times as long as you breathe in. This helps your vagus nerve to magnify the positive effects. Go ahead and use a comfortable level of intensity for each of the steps in this recipe. Step 1. Apply a light amount of pressure with the back side of the tuner while moving back and forth along the right side of your head for 2 minutes. Step 2. Lightly place the tuner just below the left collarbone and hold it there for a couple of minutes. Go ahead and move over to below the right collarbone for another 2 minutes. Step 3. Using a light amount of pressure, place the Rezzi Max tuner at the top of the left hip. At the same time, lift your left leg so that it's straight and point your toes repeatedly for 2 minutes. Now, move the tuner to the top of the right hip and complete the toe pointing exercises with your right foot for another 2 minutes.
Now that quick little set of techniques for the lymphatic system has been very, very powerful. We've seen individuals with an elephant leg, because they've removed all of their lymph nodes, have a reduction in many inches of the swelling just with that simple technique each day. With working on the lymphatic system, you need to remind a person they really need to do that daily for at least 6 weeks. You've got to get the balloon that's stretched out back into a good position and shape, and keep it that way for a long enough period for the flexibility to come back into that system. Lymphatic system needs to be done daily, whether it's on a trampoline or using our techniques or some others. Frequent work on that lymphatic system. Here's a little bit of my take on the organ work, organ activation system based on Dr. Chauvin's work. I'm going to show you applying it to specific organs.
We look typically at the nervous system and say, okay, if the toes point together and the heels are apart, and I'm putting pretty good pressure there, we say that looks pretty balanced. And it should be repeatable. One of the cool things that we found, blue is going to help a balanced system. If we put it on blue, go ahead and put this right on your belly button and just hold it there. Blue is going to support her nervous system. This is pretty fun to watch. We're pretty balanced right there. As soon as we turn this to red, we find out if she really indeed has all of her organs balanced pretty quickly. Do you see the discrepancy that just popped up? She's only had that on her belly for seconds. flip it back onto blue really quick. And why does it do this? It's because of the redundant systems. We've got other parts of the body that will kick in and try and help us stay balanced. We're trying to survive this life, right? So we've got systems that'll help us. Look how we're back in balance. When the toes point together, you're in balance. When your toes point ski-wampus, there's a problem in the system. Red will help you identify a problem in the system. What do we do with this information? And what can you do about it at home? Here's what's really cool is he then showed the belly button and why this is the great place to start. This is where you got all of your nutrition from mama. This has such a tie with the life force of our universe. This is how we keep moving forward. Let's figure out where is a problem. If we find an organ that is not a problem, we're going to see balance, especially when we're using red. Let's see if we've got a spleen issue or if we've got a pancreas issue. Hold it right there. We're below the ribs.
Red.
We're actually pretty balanced there. Let's try our liver. Liver we can access pretty good coming underneath the rib cage on the right side. What do we see? Go ahead and put it back on your spleen area. We're back in balance. So we can go away from that and say, okay, let's focus more on the liver. Is it liver or is it gallbladder? And the way to be able to tell that is maybe to come a little bit closer towards the xiphoid process or your sternum point and up there just a little bit. Is that a good spot for that? So we may have both of them as an issue, and we do. We've got her cleansing system. Isn't that weird that you can just put that on what is our unbalanced algorithm and be able to see these things? Let's just check the heart. Hold it right there. Actually, she's got a pretty good heart. Lungs. Right side, right up in here, portal. Little bit, but not much. Left lung, same spot.
Yeah.
So now we're seeing just a little bit more. Brainstem. We're just underneath the ear at the base of the skull. Pressure towards the back of the skull there. Actually pretty good. Bladder. Go to the center, right cerebellum. We're actually pretty balanced. Adrenals, you could test by placing right against the underside of the rib cage right there. Lower end of the rib cage. She's actually not looking bad there. She might have other issues, but she's got a big glaring problem that we need to kind of correct. When you take it to an area of strength, you're going to find the strength is actually pretty good. You'll find that the strength is good there, but as soon as we go to the area of weakness, bring that up.
Oh, the same leg?
Same leg. We see that the strength just backs off of there. All this is telling the brain how to pay attention to spots in the body. Some of the same techniques that work for a lot of other things help with that process. If we want to get the right side of the body communicating better, let's just turn that on really quick. And we can do that by just turning the device up fairly high, doing a little bit of scraping. Let's scrape in between and around the toes, sending that messaging and information up to the brain. Helps it immediately start paying attention better to that part of the body. We're now going to wake up the communication from tailbone to top of the spinal cord. And we're going to spend some special time with getting the communication, the nerves that go to that liver. Let's put it back on red. Let's start at the belly button. Now let's check it again. Is that not incredible? We've just cued the brain to pay better attention to her liver. Let's just check again for the fun of it. Let's just see how we are back over a couple of other areas. We have balance. Let's put it on her bladder. We have balance. Put it right up here on your liver again. We are back into balance.
Wasn't that kind of phenomenal? Wasn't that kind of crazy to see that you can use blues or greens or whites to strengthen a communication pathway? That's how many of you have been using it, myself included. But then if you use red, you can start looking at areas in the body that communication system is not working very well. In particular, you will see a number of the organs that have gone offline following a TBI, following a brain injury, a stroke, following any kind of neurologic issue, whiplash, etc. You're going to see that pattern. So you can use these imbalance or unbalanced frequencies as a way to help identify weakness patterns. Then you can wake them back up using some of our protocols. All we did with this gal on the table was our neuropathy protocol. And we started working at the toes and the plantar surface of the foot and the top dorsal surface of the foot and all the way up the leg. One of the things that didn't show in that video was we found really helpful. You can do these little circles in a clockwise direction and then circles in a counterclockwise direction right over the top of those organs. And it just strengthens the communication immediately with the brain. You can bring them back in and test them again tomorrow and see how well they're staying in. If you'll do this with the humming process, it teaches, using that vagus nerve communication, it teaches the brain how to keep connected better with a particular organ that has not been functioning very well since the brain injury. This has been really fun for me. Going back to my old injuries, we have found that cranial nerve involvement is still a problem. 38 years after my stroke, I've still had these digestive problems. Using the tools and waking back up those communication pathways for the eyes, for the cranial nerves, for the stomach, the GI system, for the feet, my own sense of neuropathy has gone away. And my own ability to feel and sense the world has improved dramatically, which is pretty fun for a guy that thought that this was what he would have for the rest of his life. I'm already feeling better. A large part of that is due to this group. You guys in IAFNR have been such a huge help for me. Ben Harris is a friend, and I have known him for a long time. I happened to go to my sister's house for a Christmas Eve party. I look over at my friend Ben that I had not seen for 5 or 6 years at this point, and I'm like, what happened? He was struggling. His eyes kept fluttering shut. He couldn't hardly balance, and I'm like, Ben, what's going on? And we started a conversation. That was now 4 months ago. I'd like you to share the rest from here, okay?
Hi, I'm Ben. 6 years ago, I was diagnosed with Meniere's disease, which in me presented as dizziness, cognitive impairment, and a few other random symptoms, and went through the whole gamut of medical treatments through 2 different ENTs. That lasted about 3 years. I wasn't able to find anything that helped for longer than a few weeks at a time. And that persisted on and off. A break for about 1.5 years where I changed my diet, and that helped tremendously. Was eating much cleaner. Returned to work. It felt 20 years younger, but then it resurfaced again, slightly different, and was re-diagnosed as chronic fatigue syndrome. Again, I had to stop working, and this time around the exertional malaise was really the killer symptom, and I just had a hard time getting the energy up to do anything through the day. Some days I had a hard time getting up out of bed, eating food. It was challenging. When I saw Sharik again at that Christmas party, for one thing, it was a miracle that I was even there. I would normally not have gone. My daughter's friends, family, and we really wanted to get to know them better. And Sharik was someone I had known through a business networking group 10 years previously. And I knew of his Rezimax, but I didn't think there was anything that applied to me or what he had been able to expand it into. He generously worked me over at the party, which was painful and alarming because I was already crashing. He is such a gentle soul, except when he gets a hold of your feet. And then he also generously donated a tuner to us and did a couple of sessions with me. I think just the fact that I had not been able to find anything that helped really challenged his professional, piqued his curiosity, and he wanted to poke and prod me some more. About 2 weeks after he started me on the Rezimax and doing a daily routine, I started to really drastically improve. I've been doing it for about 4 months. I'm not where I'd like to be yet, but I'm driving again. Most days of most weeks, I'm able to be functional, productive. Today is not as good a day. I was hoping to be better today. Maybe it's better that I'm not. Chronic fatigue is a condition which modern medicine considers there's no treatment for yet. So I had resigned myself to the fact that this is just how it was going to be for the rest of my life. I was just basically a vegetable or a very unambitious zombie. Thanks to Sharik's generosity, his patience, he's enabled me to do things that I didn't think I would be able to do ever again. I'm excited to see what the progress continues to look like in the future, and very grateful to him for developing this and for your expertise that he has picked up that has benefited me also. It's an honor and a pleasure to be here with you today.
You all studying? Sure. So we're going to come right in there. And then he's already... Okay, so this is interesting, right? So we got prefrontal in there. Push straight up. Good. You see, he gets stronger when you get him back there.
Whoa. That's cool.
One thing clinically that you could do to speed that up as well is stick that mouthpiece in his mouth right now.
What muscles use the most oxygen of any muscles in the body?
High muscles.
The oculomotor muscles, because they never rest.
Does everybody see how his left leg turns in way more than his right? Okay. You're doing great, man. You're doing great. Yep. 30 seconds. Yep. Are you serious? Yeah. Look, that goes weak right there. Hold it right there. Watch what happens. Same pattern shows up. Autonomic imbalance shows up again, and you see where that's at? That's probably the descending colon, but I don't know till I check it. So we're gonna find out.
Hey, it's 4 o'clock now? Almost 5 o'clock. So it's been a couple of hours since they did the demonstration on me, and I still feel great. My energy is up. I have no dizziness, no brain fog. All day this morning, the ride down here, I was really struggling. And as the conference was going on this morning, I could feel my energy levels dropping and knew that I was going to crash at some point today. Wasn't sure if I'd be able to make it to the end of the conference, but ever since those treatments that I had earlier, this is a very good day for me since then. So, feeling good.
I just want to finish up over the last couple of minutes with a few things. There's where you can find me in several different areas. Those of you who have found our YouTube channel, thank you. We now have over 300 videos on that channel, many of them dedicated to showing you how to use these tools to be able to help your patients. I love ending many of my discussions with a quote from Dr. Michael Trayford. Now, Michael Trayford was one of the practitioners of the year a few years ago for IAFNR. He's a really great practitioner out of North Carolina at Apex Brain Centers. He said, "Thank you for your contribution to this world. I see your invention as a musical instrument. The more I play it, the more I see its complexities and potential." Boy, we have come in the last year to really understand some new things about using that red algorithm that I had never understood before. That is really fun to be able to see turn back on areas in the nervous system that have been turned off. Let me finish with just a couple of things. You've got a few multiple choice questions pertaining to my talk. First one says, what's a key change in gut health following brain injury or concussion? I hope that you guys were able to see very quickly dysbiosis and imbalance in gut flora. Those are the big problems that we see. Greater gut permeability, enhanced digestive system enzyme production. We don't see that part much. but we definitely see the greater gut permeability. So I guess you could choose D or B on that one. Which therapy is not mentioned as a way to improve gut health and brain function? I hope that you know probiotics are excellent. Mindfulness meditation is really good. Nutritional therapies are excellent. I don't get into talking very much about antibiotics and their role, but we find it very detrimental, in fact. Which modality or modalities has shown excellent potential for improving GI and organ functioning? I hope you notice that all of those things, deep breathing exercises, organ activation, herbal remedies, cold water therapy, all of those things are really good at improving GI and organ functioning. And then what's a potential long-term effect of poor gut health after concussion? I truly believe that what we have described today is what is behind the huge increase that we have seen, especially after COVID and all of the other conditions that disconnect the brain and gut. We see chronic fatigue as a marker showing the nervous system why it's not functioning very well. I hope that all of these have been extremely helpful for you, and that if you have any questions that I can help at, please don't hesitate to reach out. Thank you.